Hi, everyone. Welcome to the Make Space for More podcast, where we talk strategies for growing and scaling your business in a way that's authentic and aligned for you. I'm your host, Melissa Swink, and in today's episode, we're going to talk about focus, energy, and productivity from a little different perspective than we normally do. If you've been listening to the podcast for a given amount of time, you realize that I talk a lot about building systems and using tools and apps and creating workflows, standard operating procedures and things, building a team, delegating, managing your calendar, all those things for, again, better energy, focus, productivity in order to grow and scale your business. But today we're going to shift perspectives a little bit and talk about this from a different angle. We're going to talk about this through the lens of optimizing our health, because I know that if I am not at my best physically, if I'm not sleeping well, if I'm not eating right, if I've got some stuff going on, no matter how hard I try, no matter how many apps I'm using or how many team members that I'm leveraging for support, I'm not at my best. I am not truly being the CEO and leader of my company, and really even just a mom and a friend and a daughter and all the things that I want to be showing up for in my life as well as I could be, just because these things are holding us back. And so today I'm really excited to introduce our guest, Kymberly Klimek. She is a functional medicine pharmacist with advanced training in endocrinology, hormone balance, and root cause healing. After personally overcoming years of chronic health struggles through functional and lifestyle medicine, she now helps others restore their health by addressing the whole person, physically, emotionally, and spiritually. As an enrolled member of the Keweenaw Bay Indian community, she integrates both science and indigenous healing perspectives to guide clients toward true, lasting wellness. Kim, welcome to the show. I am so excited to have you. You've been on my list for a very long time to have on this podcast.
Thank you so much for inviting me and having me on today. It's truly an honor and a pleasure to be here with you.
Absolutely. So I will go ahead and just share how you and I got in touch. So a couple of friends of mine have been working with you, and they spoke very highly of their interactions with you and really the results and how much better they were feeling as the result of the work that you were doing together. And so I found myself, I'll take a kind of a step back here. I'm going to make a long story short so we can dive into all the things. But I realized that my sleep has not been good since 2020. Now, there were some outside factors there in terms of, we had, for those of you who, I feel like this is something, if you know, we had an older dog who was starting to have health issues. And so he would be up during the night. And then, just once, he passed, I thought, okay, now my sleep's going to return to normal. Because I fall asleep within 5 or 10 minutes and I'm out cold until it's time to get up the next morning. And that didn't happen. And so I'm like, okay, this thing that's been waking me up, it's no longer here anymore. I'm still waking up during the night. And so by January of 2023, I was like, I need to fix this. Like, I need something to happen. I think it was 2023 or actually 2024. Now I'm getting my dates mixed up. I think we've been working together for a year and a half at this point.
Yeah,
So it was January of 24.
Yeah.
Yes. So I literally was like, I'm not sleeping well. And then when you started asking some questions and we started diving into things and we doing some testing, we're like, okay, here's all the things that are going on. So it's never just like one thing. Like all of a sudden, oh, we're going to start taking melatonin and you're going to sleep great. There's usually more that we can find below the surface. So, so you and I have worked together on improving my sleep. We've done some gut health and some cleanses and things. My daughter's been starting to work with you a little bit. So I just wanted to share personally, for those listening on the show, like Kim is somebody who I work with directly. So just wanted to make sure that you have full permission to disclose whatever you want for the way that we have worked together, as one CEO to another. But before we dive into all of the things, we're going to talk about balancing hormones, gut health, mineral levels, toxin loads, all of those things that contribute to, again, being at our best and our optimal performance. Tell us a little bit about you and how you got into this line of work.
Yes. This line of work honestly fell into my lap, and I'll explain that a little bit. I guess my why, right? A lot of us have these stories of like why we start a business or why we do what we do, especially like female entrepreneurs who just have a lot of, passion for things that they're doing. That is exactly like how I started my business. Probably in my early 20s, I was diagnosed with endometriosis, which is a chronic health condition where you're having painful periods, heavy bleeding, irregular menstrual cycles. And, as a woman, our menstrual cycle is a sign of our health. And so when there's disarray or chaos in that, I learned a lot of my health was struggling. So most people, if you're having like good menstrual cycles, you may be a little bit fatigued or tired 2 days or so before your bleed, and then maybe 1 or 3 days when you're bleeding. And I guess I would say that's kind of the norm. Whereas my own personal health journey, I was suffering, I really would only feel good about 1 to 1.5 weeks out of every month. And that was just a huge red flag to me in terms of like energy levels, sleep, digestion, and then of course struggling with everything that comes along with like having a period and having spent years with like synthetic hormones and birth control. And so my why was really after I think I had my second endometriosis surgery in 2021. So granted, I had a diagnosis in my early 20s, but I was really suffering for about 10 years before a colleague of mine had given me a little book. I was working at the time, so I'm a licensed pharmacist actually, but I practice more in this holistic space now. And it's truly through my own like revelations and my own health journey that I was able to kind of take the blinders off a little bit and see that some of the things we were doing in conventional, like outpatient chronic disease management, weren't necessarily ideal or optimal for everyone, including myself. And so when I was able to take a step back and just try something different, because of course, for 10 years, I was kind of doing everything that the medical community and the doctors and my OB-GYNs had been telling me. And it wasn't necessarily bringing me a lot of definitely not bringing me wellness on a consistent basis. And so I thought there must be something else. And it fell, like I said, it fell into my lap. A colleague of mine had given me a book called Hormone Intelligence by Dr. Aviva Ram. I think if you know anything about me, I tell everybody about this book, and I've talked about it on podcasts. I've talked about it everywhere, and it was a good like eye-opening book for me to learn that yes, lifestyle, nutrition, professional grade supplements, and these factors, toxin load, they all have a role in how our health is on a day-to-day basis. And that was just something that was never discussed with me, even in years of schooling. I went to undergrad. I did grad school for 4 years. I did a master's in public health certificate with American Indian Studies. I've done a residency program, and all throughout that 10 plus years of schooling, there was just no mention of how the body really can heal itself. And so it was wild how I read a book, and I read this book front to cover within like 2 weeks. I was so intrigued by what it was saying because it was stuff I never heard about. And I think that that hits home for a lot of people because we, as a woman particularly, we live these go lifestyles. When I was younger and in grad school and college, it was you just go, and you're running on fumes and you're studying and you're up late and you're eating sugar and anything to get by because, I mean, in grad school in particular, I feel like we lived in a whole different world as well. Just, I spent a lot of my time in the library, like on weekends and looking out the window at people actually enjoying sunshine and nature and all the things that I tell people about now and incorporate into my own tools when working with toolkits when I'm working with clients. But that was really that was how it kind of came about. And sort of when I started implementing these changes, it was lifestyle, it was nutrition, it was using professional grade supplements. I could see the changes happening for me within 3 months of just starting those things. I could feel like my body was like opening up and it was healing. And, then the rest was kind of history. I started to feel better and not have painful periods all the time and not be literally living like 1 month to the next, wondering when I was going to feel sick or not. And, that was when I had this little inkling. I went and Googled like, gosh, I'm a pharmacist and I want to do something a little bit different with my career, my healthcare license. It's definitely one of those moments where I was kicking myself like, oh my gosh, I went to school for 10 years. I do have a lot of knowledge and education regarding pathophysiology and just like cellular processes of the body and pharmaceuticals and how they work in the body and drug metabolism. And so I thought, okay, I know like health literacy, and I have a lot of education regarding like science and math. What can I do with this that's going to not only help people, but also bring fulfillment for me on a day-to-day basis? Is because I'm at a point right now, looking back when I actually made the switch, I'm at a point right now where I always tell you this, I think too, is that I truly feel that I'm doing something that resonates with me and that I was kind of born to do. And it's never work when you're just doing something that you love and you're passionate about. So people always
100%. And we talk a lot about that. Yeah. Yes. You and I have talked about that. And even just for those listening, it's about that authenticity piece, right? We're doing the work that we know that we're meant to do in the world. We know that we're making a difference and we want to do it in a way that is authentic and aligned for us. So yeah, after spending, 10 years and even longer than that, if you think about your total educational journey from childhood onward, you find yourself in a job where you're like, okay, wait a minute. I feel like this is helpful, but we're not quite there yet. And especially after, I'm going to say maybe that awakening to, oh, we can actually heal, our bodies can heal themselves when given the right tools to do so.
Yeah, 100%. That's how I run my business now. And those are the things that I tell clients about. And I really do try to help them, give them the tools and just come at it like from a whole body perspective. Like I said, it's never, even with our health, it's never just one thing. It's kind of peeling back these layers and just understanding that there's going to be several layers and several components to it. We can't fix everything at once, but I have literally seen the power in consistency and doing the little things on a consistent, regular basis that really brings so much growth and wellness for people. And sometimes it's like you mentioned the sleep thing. It's like sometimes that's going to be our primary thing when we're first starting. We may have other things going on like hormonal imbalances, thyroid dysregulation, let alone all the other like social and environmental factors that many of us are dealing with, right? And a lot of people have trauma. So that's just something like your body just holds on to those things. And I really truly realized that like lasting health and wellness is not a overnight fix, but rather a lifestyle. And if you're practicing things on a consistent, regular basis, you will move the needle. But I always tell people too, having data really helps drive the healing practice, the healing process faster. I tell people like it's helpful to be able to understand. And we've ran functional testing together. I've done all the functional testing like on myself before I even started doing anything with clients. I was like, okay, I'm going to do all this stuff for myself.
Yes.
But yeah, that data really helps, but we can talk more about that.
Absolutely.
But that's something I do in my business. If we're looking at different tests that conventional medicine doesn't necessarily run, essentially.
Yes, absolutely. And I want to touch on something with the testing portion for a moment, because this is something that you and I had chatted about even just the other day. Is it's also important, I feel like in the age that we're in, when we're inundated with so much information, whether it be, blogs or, even medical journals, TikTok, Instagram, there's so many places we're getting information from. And I think it's important to not self-diagnose. Like just because this influencer has told you like, hey, this supplement changed my life and I'm sleeping like I haven't slept in years and I feel like $1 million. Well, that might not necessarily be the right thing for you based on, a number of factors. And so I think you and I were talking about how important it is to do some testing to figure out exactly what's going on and not just guess or not just to, self-diagnose either.
Absolutely, absolutely. I think that's where so again, I had mentioned like I practice more in the functional medicine realm, and there's a difference I would say too between like naturopathic medicine too, which is beautiful in its own way, but I think there's a little bit more reliance on like symptom assessment, whereas functional medicine, it's going to combine symptom assessment, yes, too, but actual data that helps drive the recommendations we make. Because to your point, yes, I absolutely am a huge fan of like professional grade supplements. I have my own little supplement schedule I do very consistently and regularly, and I have seen the power of that come to fruition for many clients, especially when we're working with like gut and microbiome health, because it's like those are the tools, like they're so powerful to help make that shift for you, other than just, of course, we're looking at like functional nutrition. But then having the data component of it is super powerful, because it does justify why I'm making a recommendation for someone versus, I mean, there's thousands and thousands of supplements on the market. So people ask me that question all the time. Like, do you think I would benefit from X, Y, Z? I'm like, oh gosh, like this could work for 70% of the people, but maybe you're in that 30% where you have X, Y, Z and you don't actually need that supplement, you know?
Right. Yes, absolutely. So I want to dive into like really the process of if somebody knows that, I feel like the symptoms are what catch our attention. They capture our attention. Like I'm not sleeping well, or, I've got a lot of acid reflux, or I just feel like I'm tired all the time. Like those are things that I feel like draw our attention to, hey, something might not be right. So before we start talking about, symptoms, if you're noticing symptoms, what are some of the next steps of, getting this sorted out? Because again, we want to be feeling our best, especially when it comes to, running our businesses and, just our everyday interactions with loved ones. Take us to the point where you had this awakening, and then you went from, working as a pharmacist to now owning your own business as well, Innate Healing and Performance.
Yeah, such an important piece right there. First and foremost, I literally will encourage anyone and everyone, clients, friends, family, like to listen to those little red flags that your body has been giving you for years.
Yes.
It is such a like pivotal moment when you can come to fruition and come to a realization that like this is not normal. Even if you've been going consistently to the doctor and they're telling you, all your labs look normal. It is not normal. Let me be your advocate. It is not normal if you're not sleeping at night on a regular basis, if you're having painful periods, irregular cycles, chronic acne, general fatigue and chronic fatigue every day, joint aches and pains. I hear that so commonly, even in like younger individuals. And it's interesting because people are always like chalking it up to just aging and getting older. And I'm like, no, I would disagree. I've seen like 70-year-olds like out water skiing and just doing amazing things. And I know it was funny. I had like we used to do this, like it was, I think in my first year of pharmacy school, we went and, we had these, what's called the POPs partner. So we would go to this elderly, the living, what?
Interesting.
Yeah, what do you call it? The nursing homes kind of facility, like it's
nursing homes, assisted living.
But, they're kind of on their own. So, anyways, I remember she was 72-year-old. We were paired with these individuals, and she was 72, and we got to like go interview her, and we were talking to her about like her medications and things like that. But she actually like wasn't taking that many, and she genuinely just signed up for the program, I swear, to just interact with students, and she found it fun. But it was fun because she had traveled actually all around the world with her spouse, who had been deceased now, but she was showing us pictures of her international travels. And one of the things we asked her was, what's the secret to healthy aging, and like how have you been able to, she was up, about, moving around, doing all these things. One of the things she said, she's like, yeah, I never smoked or drank alcohol like my whole life. And I just focused on eating healthy foods. And that was like literally something that was so powerful to me. It has stuck in my brain like since that. But the lifestyle component of wellness is very important. And I think people forget that because there's so much emphasis on like masking symptoms in chronic disease management versus actually treating the root cause of it and just practicing and living a healthy lifestyle. And what my job is to help guide people to do that. And again, so most of the time, even when I'm helping people get things organized and we are sifting through layers, if they have chronic inflammation, if they have Hashimoto's, if they have imbalanced hormones, like those are all things I'm happy to help bring back into alignment and balance and really eradicate. Like my goal is actually to get rid of those symptoms for people. So it's not dictating their life. But then you take these principles and bring them with you for the rest of your life, because again, it's a lifestyle. So, it's like, okay, consistently taking our magnesium, our minerals and our electrolytes every day, making sure that we have blood sugar regulation and eating healthy meals, healthy fats and fiber, and organizing that for people. And as long as you're doing those things 80 to 85% of the time, when we've sort of maybe fixed or like helped the underlying conditions, because that's a lot of people will come to me when they're pretty far in the weeds.
Sure. Yep.
And it's not, and again, I love working with all types of clients, but sometimes for me, learning everything the hard way, going through years of just like healthcare trauma in general. Like I feel like it was this 10-year lifespan I put my body through, just going to doctor visit after doctor visit, gastroenterologist after, GI visits, and just doing every test under the sun only to be told that it was all normal was very disheartening and very traumatic. And I think my only why of my business is to help prevent those types of things for other people. And it's really great to see, like, even the younger population is so like very, their mindset is so different. Like they're learning about things on like Instagram and TikTok. And of course, you take everything with a grain of salt. I'm like, okay, don't follow every little,
like, these are great, great resources. And don't just automatically assume that the suggestion is a fit for you.
Question the status quo, though, right? That's what I love about it. And I don't
look into research, look into resources, that sort of thing. Yes.
You're an advocate. I don't look at a single client ever, and if they tell me a symptom, I do not ever really discredit it, because I'm like, I know what they're saying is what they're feeling. So it's my job to peel back the layers and figure out what's the root cause and what's contributing to that. And so many of my clients have a lot of small wins, and, I document those and I share those on my Instagram, and I'm very like, try to be just a personal person that they can relate with. I'm not up here. Yes, I have a medical license, and I've done a lot of schooling, but I just want to be a partner with people on their health journey, because that's what it is at the end of the day. It's still, I'm your health partner, I'm your coach. A lot of people call me Dr. Kim, whatever. You can call me that, but I'm still just going to be like, you know what, I can lead you, but at the end of the day, you're going to have to do the things consistently at home, behind closed doors, when nobody's watching, right? That's sometimes the most difficult part of health. A health journey, I would say, for people is the consistency. But it's just like, when you make that commitment, you make that self-commitment, I would say, like, there's just so many rewards on the other side is what I've been seeing for clients in my own particular health journey as well.
Absolutely. Absolutely. And so you obviously had this awakening. You then, went through additional schooling and education, and in order to be able to do this work that you're doing today. So break down maybe for us, are there common things that a client will come to you with when you've never worked with them before, and they're like, hey, like for me, I noticed I'm not sleeping as well as I used to. So what's going on with that? Is there something physical going on? Like, that was something that, initially, and then we, of course, like I said, have done hormone testing. We've done some thyroid testing. We've done some gut cleanses and things like that. And, just kind of repeat and check and kind of see, like, are we on the right track and that sort of thing. That was the initial thing for me. What are some of the things that, generally speaking, or maybe some common things that people are coming to you that they're noticing and you're helping them with?
Yeah, for sure. I mean, especially when it comes to like the female client population, it's a lot of it is like hormone balance type issues. So a lot of people will express bowel changes, like constipation, or they're like cold fingers and feet, and weight gain. Sleep issues are common though for a lot of people, and then heavy painful periods, which again is like my bread and butter with things, because it's been a blessing to be able to not have to have terrible periods, because a lot of us are learning about the consequences and negative side effects of like synthetic birth controls.
Yes.
Even younger populations are not just like instantly jumping into that. And I've loved how like even the moms and who I've worked with are very like in tune with actually trying to help their daughters and prevent these.
Yes.
They want to prevent the things from happening to their daughters too that they went through. So they're huge advocates now of trying to help educate their young ones. And I think that's great. And sometimes they're just like, I need them to hear it from you, Kim, because they're not going to listen to me because I'm their mom.
Right.
And I'm like, totally fine. I get it. Because I could swear up and down all the things my mom said when I was younger. I never listened to it. And now she was right. Like all these years, like later, I feel like most of us.
Yes. Yes. Or I hear that too, between husbands and wives, where the wives are like, you need to do this, you need to do this, you need to do this. And husband's like, whatever, like whatever. And then somebody else brings it up and it's like, hey, you know what I think I should do? And it's like the light bulb goes on. So it is like kids, spouses, family, like parents. Sometimes it is helpful to have kind of that outside perspective, kind of shedding some light on things. What are some common things that men come to you for?
Sometimes it's a little bit similar things with like digestive health. Is actually a pretty common one for some of the male clients. And then again, hormone type questions too, because testosterone is like really important for men. And sometimes if they're feeling sluggish or tired, or if they're younger and their levels are lower, it's like, why are they lower? Right. So like we're going to help treat the root causes so that they can make more and help their body be balanced and have more energy. But it's oftentimes it's sleep, hormone imbalances, and then gut issues. But I would say another thing too for a lot of people is just stress management and cortisol regulation. So symptom-wise, people will be expressing like puffiness in their face, the large bags under the eyes, weight gain, particularly in the hips, and then energy levels throughout the day, like constantly needing to refuel with caffeine, or they need that afternoon kick, or they're getting an afternoon slump, or they're just so burnt out that like as soon as they get home, they just zonk out like on the couch. Or waking up between 1 and 3 a.m. all the time, in Chinese medicine that tells us adrenal health. But I think a lot of people like never even knew that like adrenal health was a thing, because they in conventional care, like they won't really even talk about adrenals unless you're like Addison's or Cushing's disease, basically like on the very extreme spectrum of either no cortisol or very high cortisol. So, but it's actually an important factor for almost every person walking this planet. So what is, all of us in the gray area in between, that's all of us that are just managing our cortisol patterns and managing our stress on a day-to-day basis. But it becomes, that was definitely a piece of my own health journey, because I was burning the candle so thin in grad school. I was working like 2 jobs. We had tests 3 days a week in pharmacy school, and trying to have a social life, right, too. And then traveling here and there. Like I would drive back from Madison to like Green Bay to work like part-time. And it was just a crazy schedule.
Of
and
course.
So no wonder I was having hormonal issues, because I teach people too that like at the very top of our hormone like cascade is, well, I guess I would say in general, it's like your body is either going to make cortisol or it's going to come over here and make hormones. It's not going to do both unless so we have to focus on like cortisol regulation, stress management, so that our body's feeling safe and happy inside, so that it can come over here and make our primary hormones that are very important. Hormones get like a really bad rap. I feel like they're like a scary term for people, but I would say like now in today's like time frame, people are so much more open to learning about them. And it's definitely something that like I never really even got talked about it, even for 10 years with endometriosis, which is a completely, it's a complete chronic health condition that is related to the balance of estrogen and progesterone. So it just is wild to me how I never got any of those things mentioned like in an office appointment, other than the fact that I was going to have to deal with this chronic condition for the rest of my life, and it might come back. And there wasn't too many like prescription medications that can help it. And so that was just something that I couldn't live with, I would say. And I had to think outside the box and figure things out. And to your point, you were kind of like, how did you get to like where you are now? I was just like I went and Googled like, hey, is there like functional medicine pharmacists? And then I joined this functional medicine pharmacist boot camp and or alliance. And then I joined like a little boot camp, and they were teaching us like how to start our own businesses. And I'm just like, I take it all in. I was like, okay,
You're like, sign me up. This is perfect. Yeah. I found my people.
Yeah, for sure. I had done a scholarship entry to the Institute of Functional Medicine, explaining to them like why I wanted to get this training and how I wanted to help my local community and bring some more of my Native background into my practice. And I won the scholarship. And again, so the rest of that was just kind of history. It gave me, it was just the universe telling me that this was really the right path for me. And, when people like hear me speak, they can see the passion in my voice. And I don't really back down to things. I would say like I just feel like I have a lot of knowledge and experience. And then I ended up kind of quitting my little outpatient pharmacy dispensing job, and I went to work for a compounding pharmacy locally. And it was interactions with all the people in the community there that helped just kind of pushed me a little bit to starting my own business. The pharmacy was so gracious. They had sent me to do like training and everything. So I was really, really blessed to get just additional education to get me to where I am now.
So you had won the scholarship and you wanted to take what you were learning and share it with your community. And so then we were kind of talking about, I think we started talking about, you went from pharmacist to starting your business. And then after, what was it, Kim? Maybe like a year and a half, then you fully stepped into owning your business.
Yeah. So like I said, I was working at an outpatient clinic in the area, just doing outpatient pharmacy dispensing, ambulatory care, kind of chronic disease management. So like blood pressure, diabetes, all that kind of stuff. And then when I won the scholarship and was getting more training in functional medicine, I decided to part ways with that, which was really hard for me actually, because I was working at a tribal clinic and I'm part Native. And so it was really near and dear to me to be working with that kind of patient population because it felt like family for me. But I really knew that like I needed to make this change in order to like, have a career path with what I was newly passionate about. And so I started working at a local compounding pharmacy where we did all personalized medicine. So again, all based on like data and hormone levels and thyroid levels and just medicine that really treated and helped people looking with a personalized touch. And it was more of like, okay, there's not large side effects with these types of medications because you're literally replacing a potential deficiency in somebody's body that is clearly right there visible through this data and how it drastically helps people. So the pharmacy was super like they were just a wonderful stepping stone for me because it allowed me to be in the community setting, and I was answering phone calls and I was talking to people at the window. That's how it all came about. Was that, I would just start talking to people and they asked me questions and they could hear my voice, like how knowledgeable I was about it. The pharmacy had actually sent me to do hormone training and compounding through our chemical suppliers out in Texas. And then I did a hormone certification training through that program as well. Then I did the personalized medicine certification in endocrinology, all because I was very passionate about it. And it was looking at treating people from the root cause approach. And again, not really like covering up symptoms, but really trying to treat and heal them as well, in conjunction with supporting some deficiencies that they had in the body with, the whole thing for me about compounding that was so great is that like, there's just, it's all personalized to your data, not a one size fits all. And then everything can be customized, less chemicals, preservatives, fillers, all those types of things, which was like, great, because as I started to learn about how that contributes to our health, it was, that was a huge eye-opening piece for me too. So within a year, I would say within less than 2 years, it was through a lot of the community members encouraging me that this was, something I needed to do. Even my boss there was really supportive about me just starting my own LLC. And so I did, and I was doing it part-time for a little bit, but then I got busy with referrals and everybody who's been so kind to me. And I've had so many connections myself with my own personal journey. It was like reconnecting with old providers and even like different PAs, nurse practitioners, doctors who would send me referrals. Because we did like I think 2 years ago, we did like was it a year ago or 2 years ago? We did like I wanted to host a presentation in the community for providers through the pharmacy to help educate them. This one was focused really on like female hormones and hormone balance for them. But it went over so well. And then those doctors actually started sending me referrals. So it was
That's awesome.
It just, And to have them, place trust in me with their patients was huge. And so it just has blossomed, I think, over, the past months. And I just keep on rolling with whatever kind of comes my way. And each of my clients, they teach me things along the way too. I certainly don't have it all figured out, but I'm like, I just love reading and researching and learning. I'm always going to do that. I'm always going to conferences. I'm always like learning the next thing and trying to work on continuing education for my practice and for myself. So, yeah.
I love that. And that's applicable, I feel like, to so many things where you also have your community as well with other providers like yourself. So you don't have to have all the answers. You're kind of figuring out as you go. Client presents a situation or a condition that you're like, okay, I have not encountered this before, or that's interesting. And then you go back and you research and you leverage, your own network and your connections to kind of, I don't want to say crowdsource the answer, but figure out, what the next steps are. Nobody has the answer for everything.
Yeah, I was like, you hit the nail on the head. And that's how we are even in part of the small business wellness collective or the integrative wellness coalition. You should definitely follow our podcast and stuff, because we are just a big community of like-minded individuals who really want to get you better and really want to help you on your health journey and see you succeed. And that's the most powerful thing. And for me, there's no, there's no better feeling than having success with clients. And at the end of the day, I work so hard to do that with each and every single individual. And of course, everybody's health picture is very different. And there's genetic factors, environmental factors, the nutrition component. So it's, I always tell people, like, comparison truly is the thief of joy. So just know that somebody who's maybe here in their health journey, like maybe they put in 5-6 years of work on a consistent basis to get there. And if you're just starting, let's just start with the foundations, and you will see like how much better you can feel even within just like a month of doing foundations. Like I said, because I did those things with just a book to begin with. And then of course, like when you're looking for that next step and you're ready for personalized data and information and guidance, like that's where I come in with clients. And like you said, if it's something that I can't personally like pinpoint or help, I have a network of individuals who are wonderful and love to contribute to questions in regards to patient cases and things like that. And yep, I love it, because I'm definitely like I'm the science and math kind of nerd. I love the data on a piece of paper, and I'm very oriented in that functional practice, but I don't like touch the body. I don't lay hands on the body. So there's all those practitioners who I absolutely need in my network, like the chiropractic and the PT and acupuncture and visceral therapy, because you do need that, like energy flow and movement throughout the body is so important. We can have various different like blockades. And of course, then I'm looking at physical symptoms too. So it's just a beauty to be able to like have those connections. And I feel very blessed that I can just the network is so great that I can send a referral somewhere and just know that they're going to be in good hands.
Right. Yes, absolutely. So like we've been talking about, just kind of bringing all of this, kind of recapping for everybody here. We're talking about, symptoms that you have that you've been dealing with for a long time. They're not really getting better. And I think you had shared with me, even when you were working as a pharmacist, where you would notice that people kept coming back, month after month, year after year for their prescriptions, and they weren't actually getting better. Or sometimes they were even feeling worse. And, that's heartbreaking, as, for anybody, but especially, being in the healthcare industry that you're in, where it's like, what's going on? Like, how can I help? Because what they're currently doing isn't working.
Mm-hmm.
And so again, if you're dealing with, the same symptoms over and over and over again, or you've been taking the same prescriptions for, a long time and you're not, getting any better, or, maybe you're just kind of tired of feeling sick and tired at the
Yeah.
end of the day. You're like, what's going on? Again, great place to start would be, having a conversation with you. Can you tell us where our audience can connect with you? Because I know that you work with clients from, you're really poised to work with clients from anywhere, because you and I connect virtually.
Yep.
My testing it comes in a kit at home, and I can send it in. What I've done a variety of tests with you now. My supplements, can come in the mail. So it's really, really convenient. It's not like where people have to travel a long distance in order to work with you. So can you talk a little bit about how that works?
Yeah, for sure. So yeah, my business, I own Innate Healing and Performance. You can definitely just Google the website. It's www.innatehealingandperformance. I'm actually getting a new website here in July, coming up in the July or August.
Exciting.
Yeah, so that's
Business
good.
owners, the things we spend money on and we're
Yeah.
super excited about. It's like new website.
Well, when I
Yes.
first started, I just threw up a website there and it just got busy
We
fast.
all start there. Yes. So we will definitely link that in the show notes as well.
Yeah, awesome. And
Yeah.
I've definitely changed the process a little bit of how I do intake. I'm really right now, I love to get down to business kind of thing. I'm not here to waste anybody's time. Like, if you're ready for this next step and you're ready to make that commitment, I tell people, okay, go ahead and book like a 30-minute discovery call. We're going to hop on. You're going to talk to me about your biggest 3 to 4 primary symptoms or concerns that you're dealing with or struggling with right now. We'll discuss, things that you've done in the past. We don't want to repeat old things, and we'll get to going right away. If we need to order any particular tests, like, I help dictate that for people in terms of what I think they'll need, because you don't need to repeat things that have already been done, and just
Sure.
depends on like what symptoms they're presenting with. So I help them organize that, giving them recommendations. And it ranges between people who have actually done other functional medicine processes and maybe still aren't feeling like the most optimized, because it's definitely something I learned, is that there's definitely a different approach. It's hard for me with my business, I would say, because I really do everything I do is so customized to the individual. I do actually offer some packages. And if someone's like new and they're like, okay, I'm ready to do it all. I want a full blood work panel. I want a full hormone assessment. I want gut, and I want to see this transformation between 3 to 6 months, which is a very reasonable time frame, actually, I'll have for working on things with like chronic health conditions. And then there's other people who've like dabbled a little bit already into it, and they're looking for a different perspective. And so so that's why it's all customized. I think
For sure.
there's larger practices, and there's nothing wrong with that at all. Sometimes there are protocols, though, right? Like, again, 70% of the population may benefit from doing the same thing for every person, right? But then you still have some of these outliers, or like that 30% where they just haven't quite pinpointed that root cause thing, or the picture hasn't really been a full scale like picture for them. And that's like why I'm here, and that's why I do the things I do with my business. And sometimes people may be like, it's a little bit more work, and yeah, I'm still learning. I'm in the trenches of like being a business owner right now, but I have found that just genuinely I prefer to get that personalized a touch. And the other thing is, like, you're working directly with me. I am the practitioner, the provider, your partner, your coach, whatever you want to call me. Like I said, Dr. Kim. But at the end of the day, I'm guiding you and directing you on the changes, not forcing you, not demanding you to do X, Y, Z. I can only lead people, so much. And I don't really chase.
Yes.
I guess I wouldn't say I chase a lot of clients. I have expectations in terms of, if you're ready to do this, then now is. But one thing I just want to put out there as a really big message for people is, I think the other day too, I had put like a reel on my Instagram. And what was wild to me was that in America, we easily spend like $3,000 to $5,000 every year on like a deductible with chronic health conditions that are simply just being swept under the rug and managed, as you said. And what you what you're not realizing is all the progress you could make within a year of actually getting on the right path, getting personalized data.
Mhm.
And of course, it is an investment right into our health, but I always tell people it's an investment into lifelong healing and wellness for the rest of your life
Right.
versus feeling like you have to live with all arthritis and inflammation and thyroid issues like forever. So I
Mhm.
tend to be very open in terms of Western medicine when it needs to be utilized and when I think a holistic approach is going to serve us well. But and I think that's perfect. You don't want to live in the extremes of any which way, because again, I was trained as a healthcare provider. I have a lot of like medical training, and so I fully understand. I'm actually, as a pharmacist too, it's like I would never stop somebody cold turkey on a medication and just be like, okay, it's
No.
all bad for you kind of thing. I feel
Mhm.
like
Mhm.
that is, that's not doing a service to anybody. Swinging
Mhm.
super far in the extreme versions of one way or the other. I'm very supportive, and I would love to work with clients who, are maybe looking for a different perspective.
Yeah, yeah, absolutely. And I do appreciate too, I know for myself and even for my daughter, you have taken tests that, our regular, healthcare provider, our doctors have ran. And, everything's within the normal ranges, like you say. And then you've taken a look at that and you've looked at them through a different lens and a different perspective. You're like, actually, this is interesting and this kind of correlates with this. And here's what I think might be going on here. So you've been fantastic about that as well. So,
Yeah.
and I know even my provider, my OB said, she's been happy to order tests for you. I know she ordered my thyroid tests. So it's not an either or. It can be, and. So
Mm-hmm.
you can, it
Yeah.
doesn't mean, working with a functional practitioner like you doesn't necessarily mean that all of a sudden we're not working with our regular doctors anymore. Like it can really go
Correct.
hand in hand.
Such a good
Mm-hmm.
message for sure. And I definitely, like I always tell clients too, I'm like, I'm super happy to work with your PCP, primary care
Mm-hmm.
provider, and our
Yeah.
practitioner, as long as they're open to, open to that strategy as well. And again, it's
Yes.
hard, it's hit or miss sometimes. Like there are definitely some practitioners who are very like, nope, Western medicine is everything, that everything we learned in school is right. This is all woo
Mm-hmm.
woo and da da da. So it's
Mm-hmm.
like, those tend to be hard. And again, I don't really let it like alter my views. I've seen so much benefits and transformations for many people. So
Yeah.
I just kind of ignore that. I guess I would say I don't let it disrupt like how I'm operating my business. And I know there's a lot of people who do support this like field of medicine too, and it's up and coming. I would say I do feel functional
Yeah.
medicine is like the medicine of the future, and it's here now. So people are
I
looking
think
into
so
it. But
too.
like you said, you can order.
Mhm.
I do order all types of blood work and testing for clients, and then when we're
Mhm.
talking in terms of specialized, yep, I have clients around the U.S. right now so I can order blood work, find a local lab if they're going to get it done. I organize all of that for my clients, so you don't really have to worry about that.
Yep.
And then if we order functional testing, and that can be, yeah, I mean, it can be stool samples, blood work, urine testing, saliva samples. So it's all
Mhm.
in the convenience of your home. I order the
Mhm.
test kits and they get shipped to your home, and I direct you on how to get the sample, and then we submit it. Testing
Mhm.
generally takes, sometimes anywhere between 2 to 3 weeks to come back, just depending on how busy
Mhm.
the lab facilities are. And a lot of
Yep.
these are CLIA like certified, like they are legitimately certified laboratories. Um,
Mhm.
with the test, so they're not like it's not like a woo woo kind of test. Like these are
No, not
legitimate.
at all. Mhm.
Yeah, and so I do all that, and then yes, it's pretty much just direct one-on-one communication with me through our consultations, and I direct clients on exactly what they should do in terms of their test results. Right, like I create personalized supplement
Mhm.
protocols. I explain to them, okay, we're going to be doing this for 30 to 60 days, or however long the time
Mhm.
frame is. Then we're going to peel back, because sometimes and I work through all that stuff with a client. If they're like, I can't swallow a capsule, right? I'm like, okay, here's my little pharmacist brain. Okay, we got to work on liquids, tinctures,
Yes.
nutrition components. So I will rack my
Mhm.
brain. There hasn't been a case where it's just like, okay, sorry, I can't help you whatsoever. Like I figure it out. So I figure it out and help them. And I think that's just what people want. They do
Yes.
need, because of our busy lifestyles. I think
Mhm.
that's the kind of service you're paying for too. You're paying me to tell you what to do, kind of. And as long
Yeah,
as I can
specifically
organize that
for
for people.
me, based on, what the tests suggests is going on. Like it's very, very customized. So,
Yes.
and we want to be running on all cylinders because again, we're running our businesses and we have families and loved ones. We have hobbies and things that we want to have energy for. We don't want to be suffering. We don't want to be exhausted. We don't want to be in pain. We want to address it and be feeling our best. So,
correct. And I just have this big soft spot for women too, just because I know how much like women are just freaking incredible, like for all the things that they do. And I don't think it's wrong for us to want to have our hobbies, to want to have a passion, to be entrepreneurs, to be moms, like whatever you want to do. And that's in my own case. I love living it too. I try to, portray that too. A lot of people know this about me, but I participate in triathlons and I'm like, there's no way in heck I would be able to do what I do. I do half Ironmans and it's a very large commitment to training. And I'm like, my body, if there's no way I could do this with my body, if my hormones weren't balanced, if I was looking at like cortisol regulation, if I wasn't working on decreasing inflammation, keeping my like little supplement routine on a consistent basis, that helps me feel well. But I try to be that example for people and just know that wherever you are in your health journey, it's like, maybe your body's not in that place. And I wasn't, definitely not 10 years ago. You told me that I was going to be doing half Ironmans when I was dealing with like painful periods, literally like 3 weeks out of the month. I would have just thought you were crazy. But it's okay.
Yes.
That's why I was like, the body can heal. The body can heal. So
Yes, absolutely. Well, Kim, it has been truly a pleasure to have you on the show today. And to all of our listeners, thank you so much for tuning in. Grateful for you. And like I said, today was a little bit different angle when we talk about, focus, energy, productivity, because again, we can have all the physical tools in the world. We can have the best team in the world, but if we are struggling and we are being held back by fatigue and pain and so many other things, we need to take a look at that. So that's another angle of productivity I wanted to approach today. And Kim, you were the absolute perfect guest to have on the podcast today. So thank you so much, everyone, for Kim for showing up for us today, for our listeners for tuning in. And I will be back next week with another episode of Make Space for More, where we will talk more strategies for growing and scaling your business in a way that's authentic and aligned for you. Thank you so much, everyone. Have a wonderful day. Bye-bye. Thank you for tuning in to another episode of Make Space for More. We know these insights are valuable, and we hope you are inspired to keep growing your business beyond you. Remember, growth is a journey, and you don't have to go it alone. Until next time, keep automating, delegating, and elevating your business. This is Melissa Swink, and I'll see you on the next episode of Make Space for More.